is the case of our patient with hypertension. The patient's initial name is A.S. She is 63 years old and a female, born on November 11, 1955 and living in Antipolo City. She is a Roman Catholic and a Filipino. Her dental chief complaint is nahihirapan akong kumain. Her dental chief complaint is kapag kumakain ako ng bawal, nag-iinit yung tenga ko. The history of present illness for her dental chief complaint is that 6 years prior to consultation, the patient went to dentist to extract her remaining tooth. After several months, she went back to have a complete denture because she can't eat properly and wanted to have a good smile. 1 year prior to consultation, she felt that her denture didn't fit to her mouth. She can't eat properly. On the day of the consult, the clinician noticed that her patient couldn't speak properly due to loose denture. The patient complained that she couldn't eat properly. She went to UE Dental Infirmary to have a complete denture. The history of present illness for her medical chief complaint is that 3 years prior to admission, the patient felt dizzy and her blood pressure goes up whenever she gets tired and when she eats prohibited foods. The patient didn't go to a doctor for consultation. The patient went to the doctor after 3 years to have it checked because she felt something was already wrong. The doctor examined her and diagnosed her that she has hypertension. Her blood pressure that time was 140/90 mmHg and which is under stage 1 hypertension. At present, the patient experiences high blood pressure only when she eats prohibited food and got colds when the weather is cold. She takes 1 amlodipine 10 mg tablet daily for the hypertension maintenance. She is positive to high blood pressure, negative for heart murmur, negative rheumatic fever, and positive chest pain or discomfort. For the past dental history, the patient, at 57 years old, became a dentist. She went to dentist to have a complete denture. For the past medical history, at 61 years old, the patient consulted with a doctor about her signs of dizziness and sudden increase of blood pressure. She was diagnosed of hypertension. For the personal and social history, the patient is still single with no kids. She doesn't have birth. Her religion is Roman Catholic. She is the youngest child of 3 having 2 older brothers. She lives in Antipolo City with her brother in a 2-story house. Didn't smoke and drink alcoholic beverages. For the family history of the patient's mother had hypertension and 1 brother has hypertension. There is no family history of diabetes, PTB, cancer, kidney, and cardiac disease. Her father is healthy with no known systemic disease. Both parents of the patient are deceased. The father died due to old age at the age of 84 years old. The mother died due to hypertension at the age of 76.
Okay, so next, for the review of systems, it was noted that there was no complaint in weakness, fatigue, and fever. In skin, everything is negative except for itching and dryness due to eczema. There is no complaint in the head. She has a blurred vision. No complaint in ears, throat, neck, breast, although the patient has cough. There's also no complaint in gastrointestinal, urinary, genital, and no complaint in peripheral vascular, although she has a joint pain. But there is no depression and psychiatric disorder, no complaint in hematologic, and no complaint in endocrine. So for the dental general appraisal, we noted that the patient is awake and alert. She was well responsive and talks in an orderly manner. She was able to follow commands without any difficulty, and she behaves properly. Patient is also well dressed for the weather and was properly groomed. For the medical general survey, the patient felt a little dizziness but is awake and responsive, and she also behaves properly. And for her vital signs, her blood pressure was 127/80 mmHg with 72 beats per minute pulse rate and 17 beats per minute respiratory rate and 36 degrees Celsius for her temperature. And for the anthropometric measurements, The patient's weight was 75 kilograms with a height of 157 centimeters, and her BMI was 30.4, and she is obese type 1. The dental physical examination shows that for her oral examination, her face is symmetrical, there was no clicking sound in her TMJ, and there was no pain nor swelling in her temporomandibular joint. There's also no cracks or fissures and also in her lips, and there was no palpable lymph nodes and has a concave facial profile. And for the intraoral examination, she has a fair oral hygiene. The gingiva was colored pink and was firm, and there are no present pathological conditions such as elevations. There were no elevations, no fissures, coats, and the tongue was in its normal position. And next, for the medical physical examination, the patient showed that her skin, head, throat, neck, thorax, lungs, breast, abdomen, genitalia, rectal, skeletal, musculoskeletal, and neurologic assessments have no abnormal findings. However, their sinus tenderness was present due to her colds. And for the dental and medical assessment, the patient is a dentulous, so she needed complete denture, and she also has stage 1 hypertension.
Classification of hypertension for adults aged 18 years and above according to JNC. The first category is normal. The systolic is 90 to 119 mmHg and the diastolic is 60 to 79 mmHg. For pre-hypertension, the systolic is 120 to 139 mmHg and the diastolic is 80 to 89 mmHg. For stage 1 hypertension, the systolic is 140 to 159 mmHg and the diastolic is 90 to 99 mmHg. For stage 2 hypertension, the systolic is greater than 160 mmHg and the diastolic is greater than 100 mmHg. And lastly, for the isolated systolic hypertension, the systolic is greater than or equal to 140 mmHg and the diastolic is less than 90 mmHg. Next is the plan. For dental diagnostic plan, oral examination will be done, and for the medical, the urinalysis, fasting blood glucose, serum sodium, hematocrit, potassium, creatinine, and lipid profile will be done. For dental non-pharmacologic treatment plan, fabrication of complete denture will be done. For the medical non-pharmacologic treatment plan, lifestyle modification should be done to manage hypertension, which is to reduce weight, adopt DASH eating plan or dietary approaches to stop hypertension, reduction of reduced sodium intake, engage in regular physical activity, and moderation of alcohol intake. For dental pharmacologic treatment plan, no need for any medication. For the medical pharmacological treatment plan, diuretics, ACE inhibitors, ARBs, beta blockers, calcium channel blockers, vasodilators, and centrally acting agents are drugs taken by patients with hypertension. Next is the journal. Our chosen journal is the Prevalence and Correlation of Hypertension among Adult Population in Bahir Dar City, Northwest Ethiopia, a community-based cross-sectional study. The background of the study is hypertension is one of the most common causes of premature death and morbidity and has a major impact on healthcare costs. It is an important public health challenge to both developed and developing countries. The aim of this study was to determine the magnitude and correlates of hypertension. Their methodology is a community-based cross-sectional study was conducted in June 2014 among 681 adult residents of Bahir Dar City using multi-stage sampling techniques. An interview-administered questionnaire and physical measurements such as blood pressure, weight, height, and waist and hip circumferences were employed to collect the data. The data were coded, entered, and analyzed with SPSS version 16 software package. The result of the study was a total of 678 responses were included in the analysis, resulting in a response rate of 99.6%. The finding declared that 17.6%, 19.8%, and 2.2% of respondents were pre-hypertension, hypertension, stage 1, and hypertension stage 2, respectively, on screening test. The overall prevalence of hypertension with a systolic BP of greater than or equal to 140 mmHg or diastolic BP greater than 90 mmHg or non-hypertensive patient taking medications was 25.1%. According to multivariate logistic regression analysis, age, having ever smoked cigarette, number of hours spending walking or cycling per day, number of hours spending watching TV per day, history of diabetes, adding salt to food, in addition to the normal amount that is added to the food during cooking, and body mass index were statistically significant predictors of hypertension. The conclusion is that 1 out of every 4 respondents of the study had hypertension, and more than 1 out of 3 cases of hypertension did not know that they had hypertension. 17.6% of the respondents were in pre-hypertension stage, which adds to overall future risk of hypertension. Therefore, mass screening for hypertension, health education to prevent substance use, regular exercise, reducing salt consumption, and lifestyle modifications are recommended. Next is the relation of hypertension to dentistry. Hypertension is the most common diagnosed disease worldwide and is associated with increased cardiovascular risk and mortality. Many patients with hypertension have uncontrolled disease. The dentist has an important role in screening undiagnosed and undertreated hypertension, which may lead to improved monitoring and treatment. It is generally recommended that emergency dental procedures be avoided in patients with a high blood pressure of greater than 180/110 mmHg. Because of high prevalence of disease and medication use for hypertension, the dentist should be aware of the oral side effects of antihypertensive medications. Also, dentists should consider management of drug interactions of antihypertensive with medications commonly used during dental visits. For our expert opinion, according to Dr. Makasiray, if the patient has hypertension, wound healing after surgery will be harder and longer due to the high pressure of blood in the vessels, making it hard for the tooth socket to form hematoma.